On the Scene video coverage of ESC 2012 is supported by Pradaxa.
I'm Chris Cannon for On the Scene here in Munich at the ESC 2012, reporting on a colleague Jess Mega's presentation of a subgroup analysis of the ATLAS TIMI 51 trial. This was in the clinical trial update session, where she reported on the ST elevation MI patients within the broader ACS or post-ACS use of low-dose Rivaroxaban. Now, this was a study that looked at the concept of using a low-dose anticoagulant, so below the level of full anticoagulation, as an add-on to antiplatelet therapy, and 92% of the time it was dual antiplatelet therapy. In the ST elevation MI cohort, the results were very similar to the overall findings, where there was a significant reduction when adding low-dose and very low-dose Rivaroxaban on top of standard of care in cardiovascular death, MI, or stroke, and indeed cardiovascular death alone. Now, that's balanced by an increase in bleeding, but fortunately not that much of an increase in the very serious bleeding, very low rates of fatal hemorrhage. So that balanced by benefits on cardiovascular mortality with this very small increase in fatal hemorrhage, overall a very strong net benefit. Now, interestingly, the notion of using anticoagulation post-STEMI has been for avoiding mural thrombus. This is actually different, and going for a very low-dose anticoagulant is another way to attack the overall thrombotic milieu. It's under review still at FDA as to whether this would be approved, but of interest to see that it holds up in a very high-risk group of ACS patients. So for On the Scene, I'm Chris Cannon.